Hello and welcome to this video about supporting a child or young person who may be struggling with self-harm. This video is aimed for parents and carers, and you may have been directed here by a mental health professional who suggested that the tips and advice within may be of help to you. Before moving on with the presentation, we just wanted to pause for a moment to provide a content warning. This video will cover themes related to self-harm, which can bring up difficult feelings for some people. Please take a moment to consider whether now is a good time for you to watch this video. You can always return to it at a later time. If you have immediate concerns about your child's safety, please pause or stop the video here and attend to your child or use the lines provided on screen. It can be helpful to also make a note of these numbers should you require urgent advice or support from a mental health professional or healthcare professional in the future. The following video has been produced by the Child Wellbeing Practitioner team within Southwark Child and Adolescent Mental Health Services. Our team offers early intervention and preventative mental health support for children and young people whose difficulties may not have historically reached a level of severity to access CAN services. Our work involves supporting adolescents who may be experiencing low to moderate levels of anxiety or low mood, or working with parents to support primary school age children experiencing worries or behavioural difficulties. The following video aims to continue our work offering preventative support by directly providing you some psychoeducation and advice around managing self-harm. This video will cover what self-harm is and some of the reasons why people may choose to hurt themselves. It will then provide some signs to look out for which indicate that a young person might be self-harming. We will then explore different tips on how to talk to a young person about self-harm and some ideas about how to help support them move away from the need for these sort of behaviours. Finally, we will signpost you to lots of further websites and resources that you may find helpful. Self-harm often has many different definitions, but can be understood simply as behaviour directed towards oneself with the intention to cause injury or pain. It is important to note that self-harm can take many different forms, and the list provided on the screen is there as a guide rather than an exhaustive list. It can be helpful to view self-harm as any intentional action to hurt oneself when thinking about whether your child may be engaging in self-harm. Therefore, this behaviour can take many different forms. The Young Minds website has lots of helpful information for parents and is linked at the end of the video. There are many reasons why a young person may deliberately hurt themselves, and it's helpful to have an idea about the function that this behaviour may serve for them. Not all self-harm is an attempt to end one's life or a response to suicidal thoughts. It can often be used by young people as an attempt to cope with overwhelming emotions or distressing circumstances or environments. It is also important to recognise that self-harm can affect people of all ages, genders and ethnicities, and some groups may face or feel more stigma about self-harming behaviours. Please note, self-harm is not to be associated with attention-seeking, as there is often a deeper reason behind this behaviour. The list provided on screen offers some examples of different reasons why young people may hurt themselves, but there are many more reasons than these, and again, the websites at the end of the video provide a more exhaustive list. You may have already noticed signs in your young person that have left you wondering whether they may be self-harming. The list above includes signs that may indicate that somebody is struggling with self-harm. It can also be helpful to reflect on whether you have noticed any different or unusual behaviour in your young person. Adolescence, particularly, is a time period of significant development that can present challenges in of itself. Therefore, it is important to think carefully with a young person about what they may be experiencing and taking time to listen to their concerns or experiences. The next slide will provide some tips on addressing self-harm behaviours with young people, as we know this can be a really difficult thing for parents. Understandably, parents often feel extremely worried if they think or know that their child is self-harming. You may be worried that bringing this up may give your child ideas to hurt themselves or hurt themselves more, but we know that being curious about self-harm does not make this more likely. Remaining calm and having an open conversation whilst allowing the young person to take the lead can offer young people a safe space to talk about their experiences or current concerns without feeling judged. As well as self-harm being very stigmatized, young people often attempt to hide this from loved ones out of fear of upsetting them. It is important to note that a young person may not open up straight away, and it may require multiple attempts before they feel able to talk. But it is also important to follow your child's lead and notice when or if the conversation is feeling too difficult. You can always come back to it later. You may also want to plan for you and your young person to do something you enjoy after having the conversation, such as watching your favourite TV show together or going for a walk. You may also want to consider with them whether there is another safe adult in their life who they may feel comfortable confiding in. Opening up these conversations is a very important step in the management of self-harm, so feel free to pause and make a note of the tips provided on the screen. If you are able to speak with your child or young person about self-harm, it's important to think about how you might respond and to prepare yourself for the conversation, as it can be difficult for parents to hear. We will provide some tips on how parents and carers can look after their own mental well-being later on, as this is also an essential part of supporting your child. It can be helpful to consider whether you feel calm and ready to listen to the young person and provide your full attention when the time comes. First, try to focus on the feelings behind the self-harm rather than the action itself. It can then be important to think with your child and try to identify certain triggers that may have previously caused them to feel like hurting themselves. These can be certain times of the day, being around certain people, hearing certain things said, being in certain places, or witnessing certain events. These triggers will be unique to your child, so it can be very helpful to help them think about this for themselves, whilst providing suggestions if needed. Another good question can simply be to ask your child or young person how they would like you to respond and support them when they're feeling the urge to hurt themselves. If potential triggers can be removed, this is also a good idea. It's helpful to support young people to find ways to respond differently to thoughts of self-harm and to manage feelings that may cause urges to self-harm in a safer way. As self-harm is often a coping strategy used by children to regulate difficult emotions by themselves, it is important to help them find different, safer, and alternative ways to do this. These might include grounding techniques such as the 5-4-3-2-1 technique. This involves looking around the room and finding 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. The idea is to shift one's focus from internal thoughts, feelings, and sensations to what's going on in the environment. Breathing exercises can also be helpful as a means to calm down when experiencing high levels of distress, helping someone to reduce the chances of acting on urges to hurt themselves. Distraction techniques can also be helpful to shift a young person's focus, and this might be watching TV or playing video games. It is important to think with your young person about what they may find helpful and what you can do to support them. Regulating difficult emotions is a lot for one person to do on their own. Although these tools can help give children more options, it is vital that you as a parent or carer keep checking in with them and keep on offering a listening ear when they're feeling in a negative state of mind. You may want to make a plan with your young person about what they find soothing when thoughts of self-harm or urges to self-harm present, so that you have something to follow during more distressing moments. While it is really important to speak with a young person about self-harm to support them to open up, the most important thing to consider is their immediate safety. The tips on the screen can provide some guidance. Feel free to pause and take a note. If you have concerns about your child's mental health or self-harming behaviour, it is important that you visit your GP. You may also want to think about whether it would be helpful for their school to know. We have included resources at the end of the video that you may find helpful in supporting your young person. These can also be used if your child is currently waiting for support. It can be helpful to put support line information in your phone and to encourage your young person to do the same. Here you can pause the video and make a note of these helplines which offer specific support related to self-harm. As discussed throughout the video, it can understandably be very worrying for parents or carers when their child is self-harming. Therefore, it is important to focus on your own well-being too. Finding some time to rest and recharge can be helpful, as having these conversations can be triggering for your emotions, but you don't want to act out in unhelpful ways when your child's safety is the priority. You may want to consider your own support network and engage in self-care practices. These may be things you enjoy, such as meeting up with friends or exercise. It is also helpful for your young person to see how you manage stressful or challenging times in a healthy way. We have included some resources that you and your young person may find helpful. You might want to pause the video here and take note of some of these various websites and apps which provide further information, coping strategies and advice. Remember to use the South London CAMHS crisis line if you feel like you need urgent advice. Remember to use 999 or go to your nearest A&E in an emergency. Thank you for listening, and please take care of yourself.